Catherine Lourey is New South Wales Mental Health Commissioner. Catherine was appointed the New South Wales Mental Health Commissioner in 2017 and brings over 30 years' experience leading and delivering major strategic complex mental health projects at the state and national level. She's held positions at the local health districts, state government and federal government levels, understands the systemic issues facing people and services face when accessing and providing support, and is a passionate supporter of lived experience being at the core of mental health reform. She's deeply committed to improving the lives of people living with mental health issues and strengthening the communities that support them. She's recently led the development of Living Well in Focus 2020 to 2024, an updated New South Wales strategic plan for community recovery, wellbeing and mental health in New South Wales. So thank you very much, Catherine, for getting ahead of us. Thank you.
I'll forgive you.
Too enthusiastic.
Everyone, it's so wonderful to be here, and I really appreciate the opportunity and the invitation by Equally Well. The Commission is over 10 years old now, and as we've grown and as the sector and the system has grown as well, I think it's wonderful to be able to actually have a symposium on something that is absolutely so important, so central when we talk about mental health reform. Because it's always about people and people's participation in their own health journey, their own recovery. So I would like to not only commence by acknowledging the traditional custodians of the land upon which we're all gathering today, the wonderful Gadigal people of the Eora Nation. I'd like to pay my respects to elders past, present and emerging, and I extend that respect to those of you who are First Nations people here today. We know that First Nations people not only have such a strong connection to land, culture, seas, but also that they bring that holistic view of community, of health, of a person in all of their experiences through social and emotional well-being. And I think it is such a wonderful place that we live in, that we have our First Nations with such strength and such vision in that sense, that just comes from their living on the country and coming together and understanding something in a way that many of us can't have that rich history and connection. So for me, Auntie Joan's acknowledgement of country was just so powerful, and with those 81 descendants, I think that's just the most amazing thing. Good on her. I also would like to acknowledge people with lived experience. And of course, there are many of you in the room here today, but of course, I always feel privileged as a Mental Health Commissioner because I know that the Commission was actually established by the advocacy of the lived experience sector, by many of you who may be in the room here today, who wanted to have some driving force for change and reform that was inclusive, and that would hold not only our reform journey to account, but also to have an inclusive journey ahead. And so for me, lived experience is at the heart of our work. And I really want to also acknowledge the bravery, the insights, and the capacity of lived experience to step into a space boldly when sometimes that may be a difficult thing to do. I also would like to acknowledge and thank the Honourable Minister Emma McBride for her wonderful speech. I think as John had said, many of your comments and echoed through the room, but also it is wonderful to hear that, you know, the journey's not finished. There's a big journey to go ahead, and I think you have a lot of supporters and allies in that journey, so you won't be doing that alone. So, as I said, in all of the work of the Commission, the voice of lived experience of people with mental health issues, suicide, distress, and of their families, carers and kinship groups is really key to our work. And under our establishment legislation, our role is to improve the mental health and wellbeing of the community. So that's a big task, and one that obviously we don't do alone. I usually say that whilst the Commission is established as an independent agency, we don't work independently. We can't work independently. Collective action is what reform is really embedded in. And so that's why we're so pleased to be here and to be such a supporter and partner with Equally Well, because that is about not only in having inclusive voices, co-production, but about working together for meaningful change. I think having change that is not only crafted with people, but has a clear trajectory is what can harness that action and that implementation. And for me, as Commissioner, that's one of the key things. We want change, we want to see it, we want the people who we are here to work and support to realise the benefits of all of that. So I've been asked to speak on becoming an equally well country, working collaboratively to reduce health inequality. And this could be no more well-timed. We are having a national discussion on how inclusive the NDIS should be. We have communities across Australia whose health and wellbeing have been disproportionately impacted by the experience of local natural disasters. First Nations peoples continue to experience too high levels of suicidality and poor psychological health. And the life expectancy and physical health of people with mental health conditions continues to trail behind the levels enjoyed by the general community. So we are not equally well. But are we up, or are we equal to the task to remedy that, to build an equally well country? So where are we starting from? Where are the gaps that we want to eliminate? In this, it is important to acknowledge the current physical health disparities experienced by many people living with mental health issues. We know that people living with a mental health issue experience higher rates of risk factors for developing cardiovascular disease, obesity, and type 2 diabetes. We also know that these risk factors are associated with medication side effects, the healthcare system not responding adequately, the complexities in the diagnosis of mental health issues and lifestyle factors. We know these risks can be addressed and that the consequences of not addressing these risk factors can be dire. These consequences can include developing serious physical health problems, reduced quality of life, negative impacts on an individual's ability to socialise, participate in work and community activities, and worse, lowering an individual's life expectancy by up to 30 years. Tragically, the life expectancy gap continues to increase, especially for people with severe and persistent mental illness. And that inequality is untenable. These facts are known. The interventions are understood. The evidence is clear. But not enough to mobilise government, organisations and individuals to prioritise, collaborate and roll out effort at scale to reduce this health inequality and enhance the life expectancy of people living with a mental illness. So the question is, how can we work together to become an equally well country? To answer this, I believe there are 4 cornerstones to build upon. Firstly, the cornerstone built by First Nations people who have long embodied the holistic approach of a social and emotional wellbeing. Secondly, the cornerstone of evidence and our need as a society to consider prevention strategies for physical and mental health issues within a socio-economic context. Thirdly, the partnership cornerstone, where collaboration is required for a holistic effort to achieve an equally well country. Here I will outline some projects that the Commission is partnering and contributing towards for enhancing the physical health of people with a mental health issue. And lastly, the collective action cornerstone, embedding an equally well ecosystem to support people with mental health and physical health issues to achieve health parity and have long, fulfilling lives. Well Country aims for mental health and physical health parity with the rest of the community. Parity in achieving tangible health outcomes, accessing evidence-based interventions, and holistic models of care and support. And in this, we acknowledge the role of the broader health system. Our First Nations people have an approach to mental, physical, and spiritual health that embodies a collective, coordinated, person-centred and community approach. Social and emotional well-being, which sees health as complex, interwoven, and embedded in a social and historical context. The concept of parity, the quality of state of being equal or equivalent, needs to be inclusive of this holistic approach for us to forge an equally well country. The National Strategic Framework for Aboriginal and Torres Strait Islander people's mental health and social well-being identifies a number of factors that all play out in helping achieve a balanced, fulfilling state of mind. The 6 domains are the body, mind and emotions, family and kin, community, culture, and spirituality and ancestors. The framework outlines that when a person is positively experiencing all of these factors holistically, they experience wellness, mental, physical, and spiritual wellness and connection. Therefore, in considering what an equally well country may mean, it is incumbent upon us to learn what that means for different groups and communities and understand their voices, knowledge, and experience. Likewise, embracing the strengths of social and emotional well-being and its inherent connections between mental and physical health is an incredibly strong framework upon which to build an equally well country. So, in this, we recognise the importance of holistic attitudes and approaches to physical and mental health in building an equally well country. But is there equal opportunity to participate in an equally well country, to design that and experience the outcome it aims to achieve by the very groups that could most benefit from improving their health and mental health disparity? Accordingly, in laying the foundations of building an equally well country, there is the imperative of accounting for social determinants of health and the influence of social and political context. We know an individual's socioeconomic circumstance influences the frequency and intensity of their experiences with mental and physical health issues. The issues of service, affordability, accessibility, and suitability all impact an individual's capacity to make decisions for their mental health and their physical health. But even more, we know these decisions are influenced by how informed the person is, their community, and the service providers they engaged with. This is not only understanding holistic approaches, but the interplay of physical health and mental health in a person's life. Evidence shows that culturally and linguistically diverse background people are less likely to seek help for mental distress, and people living in rural and regional Australia may find it hard to find and attend a psychiatrist or a mental health clinician. We know that First Nations communities experience disproportionately higher levels of lived experience and mental health issues. And in the complex and interwoven context of people's lives, addressing both physical and mental health issues can become more convoluted for the individual, their family and community, as well as the workforce that's there to support them. The breadth of systemic barriers faced differently or commonly contribute to the person's ability not only to reach out and engage with supports, but also impacts the workforce in their role to provide best care. We know information is power, and so do we need an equally informed, equally well Australia. That is why I firmly believe that health literacy is the key enabler to support and enable a better informed workforce and community across both the health and mental health sectors. Empowered, informed healthcare decision-making optimises opportunities for prevention, early intervention and treatment in a person's life. This requires an informed, holistic workforce, as well as an informed community that better understands the decisions, risks, and the opportunities before them. This is important. 60% of Australians are estimated to have low health literacy. In New South Wales, where approximately 1.3 million people are estimated to experience mental illness each year, this represents about 780,000 people who have low health literacy. And we know that low health literacy has been associated with less engagement in prevention activities, less effective communication with healthcare professionals, poorer health outcomes, and higher healthcare costs. In the 2017 report of the United Nations Special Rapporteur for Mental Health, 3 specific factors were cited as contributing to the global burden of obstacles in mental health: the dominance of the biomedical model, power asymmetries which impact decision-making at all levels, and the biased use of evidence. While all three can be obstacles to us achieving an equally well country, it is the power asymmetries which impact decision-making that are so influential in how we design an equally well country and in personal decision-making on health choices. Improving health literacy and co-design are 2 avenues where power dynamics can be disrupted. Building an informed community on both mental health and physical health issues requires an acknowledgement of the power dynamics in play that have led to the health and mental health disparity we see today. Here, collective and collaborative action at its best is in power sharing and knowledge to achieve a common goal. Co-design and co-production are central to this, to ensure the voice of lived experience is embedded in collective action. As such, collaborative effort in policy decision-making at the government or sector level across the healthcare workforce and lived experience community is crucial. For this reason, the New South Wales Mental Health Commission is focused on contributing to efforts that improve the physical health of people living with a mental health issue. This leverages the expertise of research, contemporary practice, and the voice of lived experience. And I just want to touch on 4 areas where we've partnered with wonderful collaborators, 2 of which are here today, and I will call you out by name just to put you on notice. So we have had wonderful collaboration with Equally Well and other partners to support the Being Equally Well roadmap. The roadmap lays out changes to how clinical services can prioritise and support both the physical health and the mental health of people at the same time. The Commission, through its work, contributed to a series of roundtables focused on discussing the contributing factors and potential solutions to improve the physical health of people with persistent mental health issues, to support the development of an implementation plan for the roadmap. We have also partnered with Health Talk and Equally Well to better understand the experiences of people accessing mental health services. This developed an online resource, the physical health experiences of people who have accessed mental health services, which I'm very excited to see will be launched tomorrow at the Symposium. So all go along to that. So we were very pleased to support and contribute to this online resource as they are designed to empower consumers and the health practitioner. So thank you, Equally Well. Next, the Commission, with a focus on practical supports for people with lived experience and clinicians, partnered with Mind Gardens. So now there's a call out to the wonderful so we partnered with Mind Gardens Neuroscience Network for the co-design of mental health clinician package, targeting the physical health of people living with severe mental illness. This package provides easily accessible resources for clinicians to improve their knowledge, skills, and competence around physical health care. And I know Professor Jackie Curtis will be presenting tomorrow and will be launching this. So again, tomorrow is the day of launches. You must be here. So I think that's absolutely brilliant, keeping the body in mind. And lastly, the Commission partnered with Professor Richard Osborne from Swinburne University leading a consortia of universities in the undertaking of a $5 million Commonwealth grant to develop a mental health literacy national project. So, Minister, you can keep an eye. That is already with you somewhere in your department, and you can go look for that. You can also go to the Commission's, the New South Wales Commission's website, where we have all those resources there, or turn around and talk to Richard behind you. So that's my key tips. So this project was completed in 2022, and this National Mental Health Initiative developed an extensive online resource for the health workforce, both for mental health workers and health workers. At its heart was a holistic approach to a person's health needs, and a step to have a workforce equally confident in talking to their clients about mental health or physical health conditions. And so this goes to the heart of informed decision-making, seeing the person with all of their health needs, best supporting them to make informed decisions and assisting them in navigating to make informed services, to make informed ways to find their best service for them. As I said, these resources are available on the New South Wales Mental Health Commission's website, and I know Richard and I were very pleased when this project was accepted by the World Health Organization as one of their national health literacy demonstration projects. So it's wonderful that this project actually is an international leader as well. So thank you, Richard. And Richard will also be speaking at the symposium. So you guys have got the most brilliant program that you've put together. Congrats. So I'm going to go to my fourth cornerstone to build an equally well country, which is collective action, which actually is on display at the symposium over these next 3 days. And so we are really well advanced here, with the issue of health and mental health parity clearly defined with a common agreed goal. We have the Equally Well Consensus Statement as the platform collective action. And so the next stage is to have leadership and support from government and the non-government sector to activate large-scale collective action, and this is underway. But is it enough to sustain our momentum towards an equally well country? Once we're there, we need to ensure that those efforts are sustained and that we manage that collective effort and learn from the experiences. It's an iterative process, really. The more that we succeed, the more that we have inclusive voices and learnings, we take that and build upon it. And that's why developing and becoming an equally well country is an ongoing issue. And even when we reflect upon the last few years with COVID and the many natural disasters, for us in our sector, it is always about learning and listening and understanding how we can continue to not only to listen to people, but to iterate, reshape, and be agile so that we can keep addressing and building upon the strengths of people's lived and living experience so they have health and mental health parity. So in conclusion, I would like to say that I not only applaud the wonderful array of speakers that Equally Well have put together, but also I want to thank you for turning up, for being here, for contributing and listening. So I have a request of you all, and that is, over these days, I want you to reflect on 2 questions. 1, how would you lead your life if you knew you had less time ahead of you? Up to 25 years if you lived with severe mental illness. What would you change? 2, in your role, how can you break down the burden of obstacles to build an equally well country? We are lucky, a lucky country. We have strong partners and collaborators and a powerful lived experience voices to lead and guide us in our collective aim to have an equally well, equally inclusive and equally informed country. Thank you.